Bismillahirrahmanirrahim. Assalamu alaikum. A 37-year-old woman, gravida 2, para 1, come to the emergency department due to decreased fetal movement for the last 2 days. She has no contraction, vaginal bleeding, or leakage of fluid. The patient has no issue with this pregnancy until a few weeks ago, when she began to develop generalized itching that is worse on her feet and hands. She also had nausea for the past 3 days but no vomiting or diarrhea. The patient is recently immigrated to United States and has no prenatal care. Temperature is 37, blood pressure is 134/76, and fundal height is 38 centimeter. There is no sacral icterus. Cardiac and pulmonary examination are normal. The right upper quadrant is tender to palpation, but there is no rebound or guarding. Bilateral lower extremity have 1 plus pitting edema. Diffuse excoriation are also noted on the skin. Laboratory results are as follows: hemoglobin 12.3, mean corpuscular volume 91, platelets 140, leukocyte 8,200, total bilirubin 2.4, direct bilirubin 1.1, and total bile acid is 110 micromole per liter. The normal is 4 to 16. Come to the alkaline phosphate. Here alkaline phosphatase is also elevated. Aspartate aminotransferase is 516, alanine aminotransferase is 884. Hepatitis panel is hepatitis B antigen negative, anti-hepatitis B antibodies positive, anti-hepatitis B core antigen antibodies also negative, anti-hepatitis A IgM is negative, anti-hepatitis A IgG is positive, anti-HCV is negative. So a trans-abdominal ultrasound revealed a 38-week intrauterine gestation with no fetal cardiac activity. Which of the following is the most likely presentation in this patient? Acute fatty liver of pregnancy, acute viral hepatitis, HELP syndrome, intrahepatic cholestasis of pregnancy, preeclampsia with severe feature. So first of all, this patient is 37-year-old. She came to the office due to decreased fetal movement. The patient also developed itching that is worse on her hands and feet. On examination, she having right upper quadrant tenderness to palpation. On examination, she having bilateral lower extremity edema, which is 1 plus. There is also diffuse excoriation on her skin. Her total bile acid is increased. Her ALP is also increased on ultrasound, which revealed that there is no fetal cardiac activity. So based on these symptoms, what is the diagnosis of this question? The diagnosis of this question is intrahepatic cholestasis of pregnancy, which is also called ICP. Intrahepatic cholestasis of pregnancy, and based on these intrahepatic cholestasis of pregnancy, what is the management of intrahepatic cholestasis of pregnancy? The management is first urodeoxycholic acid, which decrease the bile acid from the blood. The second one is fetal cardiac monitoring every week, fetal cardiac monitoring. And the third one is delivery at 37-week gestation. This is the management for the intrahepatic cholestasis of pregnancy. So here the correct option is choice D. Why the choice D is the correct one? Because this patient elevated total bile acid and intrauterine fetal demise are consistent with intrahepatic cholestasis of pregnancy. Intrahepatic cholestasis of pregnancy typically occur in third trimester, as increased estrogen and progesterone level causes hepatobiliary tract stasis and decreased bile excretion, which result into elevated total bile acid, which accumulate in the liver, resulting in elevated aminotransferase and bilirubin level, and skin, resulting into pruritus that is worse on the hands and feet. Bile acid can cross the placenta and causes fetal complication as seen in this patient. Risk of intrauterine fetal demise is particularly high when bile acid is more than 100 micromole per liter. It also causes preterm delivery, meconium stent, amniotic fluid, and neonatal respiratory distress. Risk factors for intrahepatic cholestasis of pregnancy include prior intrahepatic cholestasis of pregnancy, maternal age more than 35 years, and multiple gestation. Management of intrahepatic cholestasis of pregnancy include ursodeoxycholic acid, which may decrease bile acid level, frequent antepartum monitoring, and delivery at 37-week gestation. Come to the incorrect one. Acute fatty liver of pregnancy. So acute fatty liver of pregnancy can also present with the symptom as this patient is suffering, but acute fatty liver of pregnancy also the patient also having pulmonary hepatic failure, for example, sacral icterus, encephalopathy, leukocytosis, and platelet count less than 1 lakh. Choice B, acute viral hepatitis. So as this patient is immunized against the hepatitis, so acute viral hepatitis doesn't describe the diagnosis of this patient. Choice C, HELP syndrome. So as we already know that the HELP syndrome is hemolysis, elevated liver enzyme, and low platelets. This patient having this patient doesn't having hemolysis, and her platelet count is more than 1 lakh, so she doesn't describe, so this patient doesn't describe the diagnosis of a HELP syndrome. Choice E, pre-eclampsia with severe feature. So as we already know that pre-eclampsia with severe feature can present the patient with with edema and with elevated liver enzyme, but the patient can also have hypertension. This patient is hypertensive, so doesn't make the diagnosis of pre-eclampsia with severe feature.